Have you eaten today? No? Okay, let's start there. You haven't been able to get out of bed, you're crying every day, so you're sad? That's okay. Time isn't real anyways. Do you want a blanket? You're 5 minutes late. We're gonna have to cut that out of your session. Do you want a blanket?
I've gotten tagged by 2 separate people in that video, and I've been sent this video by so many people. And there is certainly some truth to that. Though, I really hope psychiatrists out there are not kind of like short or cold with patients. But within every joke, there is a kernel of truth. So why are psychiatrists a lot more direct, usually, than therapists? And I think this is a phenomenon that naturally happens in treatment. And I think one of the main reasons why it happens is frequency of appointments. Very rarely do I see people on a weekly basis or a bi-weekly basis. Maybe I will do that for a short amount of time if they don't have a therapist and, I need to give them the supportive therapy, or if we are doing some, very rapid adjustments with medications. But the majority of the time, my average patient is seen every month, and I really want to get it to every 3 months. I want us to be on a stable regimen where we only have to check in quarterly. But though the work in therapy and psychiatry both address mental health, the work in psychiatry is trying to use medications that biologically mediate mood, anxiety, sleep, etc. And the work in therapy is to give you space to think freely so that you can discover yourself in a safe environment. Now, I don't get the opportunity to do this because I don't see people that regularly. But what I tend to do, because I would rather them not feel necessarily unsafe with me, but almost hear kind of like a hard truth from their psychiatrist and then bring that back to their therapist and say, well, my psychiatrist says I have mommy issues. Where's that coming from? And the good therapist feeds off of that, right? It's well, what kind of feeling did you have when the psychiatrist said that? It's almost like a mom and dad dynamic. And I really want to shy away from that example because I do not want to paternalize psychiatric care, and we should not do that. But if you're ever wondering why your psychiatrist might be a bit more direct, it's not because they don't like you. It's you should take that information back to the therapist and discuss it. And they very well could be wrong, by the way.